Let's go back to Beth Roberts, who now has a question on healthcare access, and let's direct that to Governor Lynch.
Okay, Governor. The rising cost of healthcare is consistently cited by chamber members and businesses across New Hampshire as a top concern. Keeping in mind the new federal healthcare reform law and its ongoing implementation here in New Hampshire, what will you, as governor, do to ensure healthcare access and affordability, for families and business owners alike?
It's a great question, Beth, and you and I have talked about that over the years. There are important initiatives coming out of national healthcare reform. It prohibits insurance companies, with all due respect, from denying coverage to children with pre-existing condition, reduces prescription drug costs for seniors, something that's very important to the AARP, allows young people to stay on their parents' health insurance plan until age 26. So there are a lot of good things coming out of national health care reform, but I don't think it does enough in terms of addressing costs. And as governor, I've been very outspoken about that. Here in New Hampshire, we are addressing that. We have a pilot program with accountable care organizations, 5 accountable care organizations in New Hampshire, where we're getting away from fee-for-service and incentives to greater utilization, focusing on patient outcomes as a way to deal with costs. We're using technology, electronic medical records, prescribing medication electronically, which should allow us to improve quality and stabilize costs. And we're working toward greater transparency, which I think ultimately will allow the consumer to make decisions as to the best place to go for care and treatment.
Governor, thank you. Mr. Stephen.
In all due respect, Beth, how does a bill, Obamacare, that takes $500 billion in cuts to our seniors' Medicare program, increase access and affordability? How does a bill that downshifts costs to our state budget over a 10-year period, $1.2 billion, we're going to lose over $130 million in year 2014 from our budget? How does a bill that doesn't help Next Step Orthotics, Matt Albuquerque, who puts prosthetic devices on folks that come back from the war, our veterans, and helps them continue to maintain their lifestyle, how does that help when he doesn't even know what the tax is going to be on those devices? I've asked the governor to take a stand. Join those 22 states. As governor, one of the first things I do is join the 23 states that have filed the lawsuit against Obamacare to make sure we don't have this ever-encroaching more government law into our state. But I'll go one step further, because I know how we can cut costs in our healthcare system and make it more affordable by transparency, more competition, less regulation, and also making sure we look at our frivolous litigation issues as well.
A follow-up for Mr. Stephen.
What specific challenges and opportunities do you see for New Hampshire in the healthcare law?
First of all, the healthcare law is only going to hurt New Hampshire. Beth, the companies that I've talked to, small businesses, are worried about what the tax implication is going to be for their companies. Also, the government's going to lose $1.2 billion of downshifting costs to our state budget. You know, we can't allow this law to pass and to come into our state. What I want to do is have the legislature pass what I would call a Healthcare Choices Act that basically says that nobody in New Hampshire, no citizen or a provider, shall be forced by any government, state or federal, to prescribe or to join a healthcare plan not of their choice. And then we can start looking at reasonable reforms here in our state. When the governor ran in his first election, he said he was going to reduce the cost of healthcare. Have we seen healthcare costs be reduced? No. All the governor's done is increase the cost of doing businesses for businesses by increasing business taxes.
Governor, you have 1 minute.
National healthcare reform, as you also know, Beth, they offer tax credit for small businesses, which offer health insurance to their workers. And that's going to be a significant help to small businesses. I talk with many small business owners who, because of the rising cost of healthcare, are forced to reduce coverage for their employees, in some cases drop coverage for their employees. So that's going to be a significant help. Exchanges put in place, which allows consumers to shop among various health plans, and hopefully that will be done on a regional basis. John Stephen publicly has said that the way he's going to address the budget in the next biennium is to cut Medicaid costs by $300 million. $300 million. That's over half of our Medicaid dollars that we spend. It's not possible to do that without throwing off of Medicaid tens of thousands of seniors, tens and thousands of children and pregnant women. And I don't think that's who we are in New Hampshire. I think we can balance the budget, cut spending, but still look out for the most vulnerable citizens who depend on state government to get them through the day and to make a difference in their lives.
We take a minute and stay on this. Will you lay out a little bit more about your plans?
Yes, I'd
Take
love to.
30 seconds, please.
It's only the plan that's in place in over 40 states in our country. It's plans that I helped other governors with. It's called Managed Medicaid, Managed Care. It's if you go to Anthem, Cigna, or a provider, Beth, you know as well as anyone, you have to go through a provider, and one provider indicates you'd save $300 million a year. You know, we have 150,000 plus or minus people on Medicaid in New Hampshire. They're not receiving a primary care doctor. They can go anywhere they want for health care. They show up in high-cost settings, and there's no managed care at all. A provider has indicated, Scott, that saved $300 million. This past session, the governor fought against attempts to put that in place. There was a bill that Jeb Bradley had filed. I would make sure we support that and move forward.
Governor, 30 seconds.
We are looking at managed care for Medicaid here in New Hampshire, but I'll have to be honest with you. It's not going to generate the kind of savings that John Stephen is talking about. The author of the report, Anthem, even admits it's not going to generate that kind of savings. His plan, when he cuts Medicaid by $300 million, will in fact disenroll tens of thousands of seniors and pregnant women and children from Medicaid rolls. And that's not right to do. That's not what we are as a state. His plan to cut $300 million, that's over half of what we spend on Medicaid today. And that's not possible to do.